Absolutely everybody, regardless who they are and where they live in this country. So, Chair, the perpetual crisis of our health system mirrors the glaring inequalities of our society in Ireland today. According to the public health experts, health outcomes and our general well-being are deeply affected by inequality and income and inequality to access to health services. Access to health care when needed is a fundamental human right. From the moment we are born, in the course of life's challenges, somewhere along the way, we will all need a health system that takes care of us at a time of need. The Department of Health has been compared with Angola, but even Angola managed to dig up its landmines to find a peace settlement to resolve the bitter conflict that ravaged its country. The recent report by the Irish Cancer Society that waiting times for life-saving tests for cancer patients are up to 25 times longer for public patients than for those paid privately is both distressing and shocking. The report highlighted striking differences in access for public patients compared to private patients, with GPs reporting that some public patients have to wait up to 480 days extra for ultrasound. That's well over a year waiting for a cancer investigation. The report also quoted from the Irish College of General Practitioners, delays in accessing diagnostics force many patients to pay for scans and tests privately to secure diagnosis. As a result, a patient's ability to pay is linked to their ability to access diagnostics used to detect cancer in a timely manner. The report gets to the heart of what is wrong with our health system. I would even go further and say that this neglect of cancer patients amounts of negligence and violations of basic human rights to health care. In its crudest form, if you have ability to pay, you can skip the queue and access early intervention for cancer and better life outcomes. Health care shouldn't be about queuing for years. It shouldn't be about how big your wallet is. It should be about delivery of universal health care that is not based on your ability to pay or discrimination based on income or social class. If it was any other form of discrimination based on ethnicity or sexual orientation, this health system loophole would have been quite rightly closed down by now. It is no coincidence that successive right-wing governments led by Fianna Fáil or Fine Gael have created a two-tier health system. Both parties apply the logic of the market to water, housing, transport and also to health. From them, profits always come first, even if, such as the tragic death of Susie Long, patients die waiting. Another example of government's failure in early intervention is our health service in waiting times for children with special needs. In a reply to a parliamentary question I tabled a number of weeks ago, the average waiting time in Dublin Midwest for speech and language therapists is 12 to 18 months, and for an occupational therapist it is 18 months to 2 years. These waiting times are only for assessment and do not include a further wait for treatment. This is clearly unacceptable. Children cannot be expected routinely to wait more than half their lives for an intervention that needs to be done as early as possible. Inclusion Ireland has stated that Ireland is in breach of recommended number of children who should be assigned to each speech and language therapist. Inclusion Ireland commented that the recommended caseload size was 30 to 65 children per therapist. But in Ireland, the national average is an unbelievable 162 children per therapist. To meet international standards, the number of speech and language therapists working in children's disability service would have to be tripled. That's from its current level of 283 speech and language therapists to 800. Inclusion Ireland and other agencies report that increasingly hard-pressed families are incurring financial hardship by having to pay for service that they cannot access through the public system. In conclusion, Cian Carla, it is good that we're having this debate about the Irish Health Service. I hope that by adopting this motion, we are making a start by abolishing the two-tier health service that is not fit for purpose. I have worked in the health service for the past 16 years. I know that the fault line does not lie with the staff, who are very, very dedicated and extremely professional in what they do. Most people will tell you that when they use the health service, their experience of frontline staff is incredibly positive. Having gone through numerous pay cuts and cutbacks in the past 8 years, it is testament to the staff of the health service, to their dedication, that we have a functional health service at all.
Thank you, Deputy. I'll have to ask you to conclude. I have to allow in the other members.
Ireland spends more on our two-tier health service than any other European country. But if we don't get a good service as countries who spend more on public health service than a private service, it's time to move away from profiteering, away from buying and selling health care for profit, and to follow the international evidence that one-tier publicly funded not-for-profit health care is by the
Can I call on Dr. Michael Harty, please? You have 10 minutes. Thank you, Deputy.